Even in emergency cases, there are often delays in obtaining essential medicines and conducting lab tests or x-rays.
Public hospitals can supply only very limited resources. Healthcare professionals have to ask patients to buy gloves and syringes at an outside pharmacy.
Hello and welcome to Dohathan, the weekly podcast from the Frontier family about human rights stories from Myanmar. Myanmar's government-run hospitals have been facing dire medicine, equipment, and staffing shortages since the 2021 coup, and they are passing the burden of these shortfalls onto poor people who are most in need of low-cost health care. In June, Khin Maung, age 38, took his wife to a public hospital after she complained of abdominal pain. A checkup revealed that she had a mass in her uterus that required surgery, but doctors said it was not an emergency.
The surgery date was set for a month later. We went home, but her condition worsened. She had to be readmitted to the hospital. They kept saying it was not an emergency and refused to operate. And she ended up staying in the hospital for almost a month. When they eventually operated and did tests, they found the mass was cancerous. It would have been much better if they had operated earlier. The costs for inpatient care aren't small.
Khin Maung's wife is now receiving chemotherapy at the hospital.
After the cancer was diagnosed, a nurse explained that the hospital would cover half the cost of chemotherapy drugs. But she also warned that if the drug supply ran out during treatment, we would need to pay for the half that was initially provided free of charge.
Khin Maung works and has a regular income, but it is not enough to support his family of 4, including 2 children. Despite the inadequate care, he must rely on the public hospital because he cannot afford private health care. Since the 2021 military coup and the resulting economic downturn, many people have struggled with financial difficulties, limited job opportunities, and rising commodity prices. Increased costs of medicine and healthcare have exacerbated these difficulties. In these circumstances, many people like Khin Maung, who can no longer afford private hospitals, are turning to public hospitals, which operate under the military regime's Ministry of Health. At the same time, healthcare services at public hospitals have worsened since the coup. Before 2021, funding from international NGOs and donors allowed public hospitals to provide free services for patients who could not afford treatment. But after the coup, such aid dropped off, putting more of the burden on ordinary citizens, according to Dr. Coco, who used to work at Yangon General Hospital.
After the military takeover, the government sharply cut its health budget. This has led to shortages of supplies and disruptions in operations in the country's most important immunization programs. As a result, young children are not receiving vaccines on time. Vaccination programs have been halted, and financial support is insufficient.
Among those facing healthcare problems is Ma Sandar, a 56-year-old single mother who needs surgery to remove a lump from her leg. She works as a daily wage housemaid and has 3 children, aged 15, 12, and 8. She initially decided against the operation because she could not afford it, but eventually had to seek care at a public hospital.
We are struggling just to afford food, so I was against having leg surgery. But when the pain becomes unbearable, I have to rush to a public hospital. I didn't have to pay for the examination, but they asked us to buy medicine and supplies needed for the surgery. My daughter cried when she heard this. We went to the public hospital because we had no money, but they made us buy everything, even the surgical needles.
Dr. Mya, who works at a public hospital, said that since the coup, the healthcare budget has been drastically reduced, and the hospital can no longer provide even the most basic medications or supplies.
Public hospitals can supply only very limited resources. Healthcare professionals have to ask patients to buy gloves and syringes at an outside pharmacy. We even have to make written list of items that a patient must buy upon admission. Patients who are extremely poor said they can't afford it. In such cases, we ask them to buy only the most essential items. Some patients stare at the list with a blank expression. They don't dare complain to the doctors. They sigh and go buy the items at the pharmacy.
Another issue is staff shortages. Before the coup, the Ministry of Health employed over 100,000 staff, nearly half of whom participated in the civil disobedience movement. Dr. Koko said that nearly 40% of the staff at Yangon General Hospital participated in the CDM, and only around 10% eventually returned to their posts afterward. Because of this, there is a severe imbalance between the number of patients and the available medical personnel at the hospital, creating a situation where the staff is struggling with an overwhelming workload.
There are delays in diagnosis and treatment, and each patient faces long waiting times. Even in emergency cases, there are often delays in obtaining essential medicines and conducting lab tests or X-rays. Under the current circumstances, roughly 6 healthcare workers are responsible for serving around 10,000 patients. The current staff face significant stress, and many are experiencing burnout.
Amid these difficulties, the relationship between healthcare workers and patients has also deteriorated. The services provided by public hospitals are notorious among the public. Khin Maung shared his experience.
Some nurses are impatient with patients. If you ask them a question, they start yelling before you even finish what you're saying. The way they treat patients is unnecessarily rude and arrogant. I understand they have to deal with a lot of patients, but their attitude is more aggressive than it needs to be.
The military regime only allocates just over 8% of the total national budget to the Ministries of Education and Health. The junta has repeatedly claimed it would direct more funding into these two areas, but instead it has increased military expenditures year by year. Amid mounting struggles for day-to-day survival by ordinary people in Myanmar, the cost of healthcare adds an additional burden. Ma Sandar pointed out that public hospitals are supposed to be for the people.
At a time when the public is struggling, there should at least be basic medicines and medical supplies. The fact that we have to buy every single thing now, from needles to tubes, make it incredibly difficult for people who truly have no money.
Thanks for listening to this edition of dohathan. This project on human rights reporting is supported by Fundación Hirondelle, with the help of our donors. This episode is produced by freelance journalist Manman. Some names and voices may have been changed to protect contributors. We would welcome your feedback on social media, and please follow or subscribe to our pages. You can listen to our podcasts via the dohathan Facebook page. They can also be found on SoundCloud, YouTube, iTunes, Spotify, and Telegram. Please tune in again next week.